everyone. Thanks for tuning in today for this live session. Yeah, it's the Sickle Cell Awareness Month, and the theme is Together We Can. At Dr. Sickle Cell, we view the Sickle Cell Awareness Month as a unique opportunity to coordinate global, regional, and local effort in overcoming sickle cell. And today we're going to be discussing on the topic, how we can together overcome sickle cell from the perspective of an advocate. And we're having our guest all the way from Ghana. She is a very strong advocate for sickle cell. She is the founder for SickleLife Ghana. Her name is Dr. Enam Bankas. So Dr. Enam, over to you.
Eddie, thank you for having me. Some people are having technical challenges.
Okay, Dr. Enam, go ahead. It's the network. So, we're trying to work on it.
Okay. Me in touch with a medical doctor who also had sickle cell disease. His name was Dr. Paul Mensah. May he rest in peace. And just the interaction and engagement with him, it empowered me, it encouraged me. And so now at SickleLife, what we do is that we also organize annual mentorship projects for adolescents in the various sickle cell disease clinics. And then we show them people living with sickle cell disease who are excelling, so that the myth about dying before 18 years or not being able to do the professions that they want. I mean, there's me, I'm a medical doctor living with sickle cell disease. So this is proof that you can excel with sickle cell disease. And apart from that, we have a very strong support group. So our support group is mostly online. It's a WhatsApp platform, but then we reach them one-on-one too. And I mean, they are always engaging with each other. This morning, there was a conversation about hydroxyurea, side effects, for reviews, and things like that. So it's quite spontaneous. Anybody raises whatever issue is dear to them or is a pressing need, and then we try to. So apart from our online advocacy with our social media and then support group and also the in-person interactions like the screening and the mentorship projects, we also offer social support. So if we are contacted about, say, a patient who has financial challenges, is on admission or something of the sort, we raise funds to assist them in the clinic. So these are just a few of the things that we do and have been doing over the past few years. We've been around for about 6 years, and has there been a change? I think there has, because when we first came into the scene, there wasn't so much engagement about sickle cell disease online. There were some NGOs present, but then their focus is more on the screening and then the work that is done in rural areas. But then for us, we wanted to engage people online as well as in person. And we've seen a dramatic improvement in the amount of engagement online. Like when you're on a normal Facebook group that is not specifically about sickle cell disease, sometimes you see that somebody posts something, nice. You just see the outpouring of comments about it's dangerous. I'm also AS, or I have a child who has sickle cell disease, or get in touch with SickleLife, or I have a colleague. Like, there's more knowledge about the condition in general. So for me, that's a win. But then apart from that, on the ground in hospitals and health facilities, I think that there's a lot more that can be done, because every day we keep getting people living with sickle cell disease and coming on admission with sometimes preventable complications of the condition. But then it seems like they didn't even know that that condition was even due to sickle cell disease. And for example, something like priapism or retinopathy. Priapism is like prolonged erections. Retinopathy, like blindness due to sickle cell disease. Sometimes people have the condition and then they get these things which are preventable, but then they didn't even know that it is something that can happen due to sickle cell disease. So then these are areas that we still need to talk about. Things like hydroxyurea, people haven't even heard about it in 2020, but then they go to a health facility. It's not like they don't go to clinic. They go to a health facility somewhere and they are seen when they are sick, but then that conversation hasn't been had. So things like this are areas that we think more attention needs to be put. Also, with the larger things of government's involvement with things regarding sickle cell disease. So for example, having our medications and our care on NHIS, these are yet to be done. We came in 2016, 2015, and these weren't there, and it's 2020. We still have these challenges. So for me, I feel like regarding education, yes, there's a little more education and information out there. People are able to get resources about sickle cell disease. But again, because we are mostly online and it's very difficult to reach the rural areas, some people are being left out of the conversation, and we only reach them when they come to us with severe disease. So these are just some of the challenges that we have in Ghana. I don't know whether it's a little different in Nigeria, and it's not surprising considering that we are neighbors and siblings, as they say. So it's not too surprising. Regarding what stakeholders are doing to respond to the challenges, I think that for me, regarding what stakeholders are doing for the challenges, I think that for me, the first thing is to recognize that there are many stakeholders. So we as patients are stakeholders, advocates are stakeholders, the health workers, we are stakeholders, our teachers, our parliamentarians, the president of the country, everyone is a stakeholder in the management of sickle cell disease. So we all have roles that we can play to manage the condition. So on the part of patients, I think with the awareness and with the advocacy that we are doing, more patients are beginning to know that they have rights. They are beginning to know what to expect about the condition. They're beginning to know that there are some complications that may occur. So when they go to the hospital, if certain things are not addressed, they are able to ask certain questions. For example, we've educated them that when you are SC, you are at a higher risk of getting retinopathy or going blind from sickle cell. And when you're a person who is SC and goes to the hospital, even if it is not mentioned, they ask to have an ophthalmology review. So that's a win for us with regard to patients, that with more advocacy, we are having more outspoken patients and they're able to seek their own welfare and ensure that their rights are protected. Regarding the advocates, I think that we are also making strides. So we are having more of more volunteering to assist with sickle cell disease. And from the applications we get at SickleLife, it's obvious that all of us have a sickle cell story because we get people who have the condition themselves or have a sibling, a relative, a colleague at work or school. And we are all affected by it in one way or the other. So we as the NGOs creating platforms where people shout and then ways to support is also a win, because then now people have that burning desire to help, have found ways to channel it to assist people living with sickle cell disease and the general public. So with the NGOs and the small groups, I believe that we are also making strides. There's a lot more that can be done, but then for now, I think that we are on the right path. For the politicians, for policy makers, I think that there's a lot more that can be done. In the past 6 years, I don't really think there has been any major improvement or change in sickle cell disease in Ghana. I know last year or early this year, there was the Novartis Ministry of Health MOU to make hydroxyurea available in Ghana, make it nationwide. So yes, that's a win. Unfortunately, we are still this hydroxyurea to be put on our national health insurance. So until that is done, even though we've started the process, we've still not reached the end. So until we've put hydroxyurea on our NHIS, I don't think that we can say that we've reached the end. So we also have a newborn screening project that has been in Ghana for many years, but then unfortunately it's still at the pilot level. So it hasn't gone beyond a few facilities in the capital. But then we are hoping that at this time, as one of the leading countries in respect to health and sickle cell, we should have a nationwide newborn screening policy so that every child born with sickle cell disease in the country can be screened. So for the larger things, the bigger nationwide things that need to be done, unfortunately, we are not yet there. There are issues regarding training of health workers. I think that the curriculum for medical school is woefully inadequate, because for me, I can barely remember how many sessions I had on sickle cell disease. Meanwhile, we have so many people living with sickle cell disease in the country. So if we are training health workers who are not fully equipped to handle sickle cell disease, it's no wonder that we see some of the complaints that we are seeing currently. And so we need to do more on that front. So there are some wins, and then there are some areas that we need to win and to do more on. But for me, I think on the whole, it's much better than probably 5 years ago, because now there's more awareness. And once awareness is better, we can begin to ask for the things that we need. So I'll just share a bit of why SickleLife. So as I said, personally, yes, I have sickle cell disease. And for me, growing up, I knew I wanted to do something to help people living with sickle cell disease. I actually keep saying that I wanted to be a hematologist before I wanted to be a doctor, because I found out that hematologists are the people who take care of people with sickle cell disease, and I hadn't figured out that they are also doctors. So I always knew I wanted to do something to assist people living with sickle cell disease. And I don't think I faced much stigmatization or challenges regarding sickle cell disease growing up, because I had a very sheltered childhood. And my mom is a nurse, and I lived in a hospital community. My school was mostly kids of doctors and nurses, so I didn't really face much stigmatization. There were times where I would want to do things like all the kids were around having a race or something, and then my teacher will prevent me from doing it because, of course, they know better, and they were actually being good stakeholders in the management of sickle cell, because they had been informed that I had a particular challenge. And so those were the only times when I felt different. Other than that, throughout basic school, I think I was good. I remember I'd fall sick, and then my mom would be called. She'd come pick me and take me to the hospital. And as I said, I lived in the hospital community. It was just like a 5-minute drive. But then at one point, there was another child in my class who died. And then I was told, like, I knew that that boy had what I had. So when he died, that one shook me a bit, because I was like, whoa, is that the same thing that's going to happen to me? So from that, at that point, I became conscious that there was something definitely different for me, and I needed to be more cautious. But then it wasn't anything over the top. I was still a happy child running around playing. But then my mom would always make sure that I didn't overexert myself. I think that the real challenge with sickle cell disease came on when I went into senior high school, because then I had moved from my sheltered environment into a setting where people were coming from different places, and it wasn't just doctors and nurses' children. And then there, the health workers, the teachers too didn't really understand what sickle cell disease was. So I'd fall sick, my mom would be called, she'll come get me, take me to the hospital, bring me back. I'd be there for like 3 days, fall sick again. And it was just, it kept on happening because the environment wasn't accommodating, because even basic things like providing warm water was a challenge. But so at a point I had to leave the boarding house, because I mean, my health versus staying in the boarding house. And it was quite a challenge, because I remember that even going into senior high school, my mom was told that I can't do science because science is so stressful and that it will make me fall sick. And that's one of the important things why we do the mentorship project, because for the mentorship project, these kids come with their parents. So then you get to see that this is a person who has sickle cell disease and also is a medical doctor. So obviously they did science. So as a parent, then you are reassured that, okay, if your child wants to be a doctor too, they can also go to senior high school and study science. So that was one of the turning points in my life, that in senior high school, they said I couldn't do science, but then I went in and studied science, and then I kept on falling sick. So that was the point at which I was introduced to Dr. Paul Mensah, may he rest in peace, that I mentioned earlier, because the challenges were just too many. I kept on falling ill repeatedly. And so with that experience, even for me, the most traumatizing of the experiences regarding senior high school was that at a point, one of my teachers, a biology teacher at that, said that me talking about sickle cell disease was a sign of not having faith in God. And I mean, that was like, it was a very big blow to me, because he was a biology teacher, and that was when I was beginning to form my interest in talking about sickle cell disease. So it really made me actually want to talk more about sickle cell disease, but I didn't know how, and I didn't have a platform to do so. So I just had that burning desire till somewhere in medical school, where again, I started having challenges with sickle cell disease. So what happened was that I had one of the complications of sickle cell disease, that's avascular necrosis of head of femur. It was bilateral. So I had issues with my bones, both. So for a while, I could not go for lectures, I couldn't go for clinicals, I could not stand, I could not walk. And so I decided to just, so in fact, I didn't have a choice. I had to stay in my hostel because I couldn't walk. And so during that time, I just started blogging my experience. And because one of the things I was also told was that I couldn't do any like physical activity. So no jogging, basketball, all the things I really liked, I was done in them. So then I just started writing because I basically didn't have an alternative. And so it was through writing that this whole idea of let's take it up and pick it from there and make something else out of it come up. And so from that experience, we just started SickleLife.wordpress.com, started writing, sharing experiences, and other people wanted to share their experiences. And then straight out of medical school, we were like, okay, enough of the right now, let's do things. We are not commemorating World Sickle Cell Day. So for our first activity, we are coming out with a bang. We're going to commemorate World Sickle Cell Day as it should. And so then in 2016, we had our World Sickle Cell Day commemoration. I remember we screened about 100 people, and we got a little over 50 units of blood donated that year. We partnered with a number of the existing sickle cell disease NGOs, because for us, it was never about coming over from the people who were there. We were here to partner with whoever was in the space, to learn from them, to collaborate, and to ensure that a lot more is done for people living with sickle cell disease. So that was basically what led to the formation of this organization and what we've been doing so far. For what I think we can do so that we have more effectiveness in Ghana and in fact Africa, I think that the main thing is collaboration and partnerships. So for me, as I said, from the very beginning, we reached out to existing entities and then we partnered with them. From that time, we kept on reaching out to other NGOs or being contacted by others and then trying to work together. Some of them were fabulous. We had very productive, impactful collaboration, but then some of them were dysfunctional. We just couldn't see eye to eye, and we ended up wasting each other's time and not actually meeting our collective objectives, and we might have been better off working separately. So for me, I think that for the things we need as Africans to ensure that we put sickle cell disease on the map, it's collaboration, because again, the statistics, it shows that more people living with this are in this part of the world. I mean, 300,000 people are born with sickle cell disease every year, but then about 80% of them are in sub-Saharan Africa. I know that for Ghana, for example, 2% of the babies born every year have sickle cell disease. That's 15,000 babies every year who are born with sickle cell disease. but then we keep on having petty squabbles and not agreeing amongst ourselves, and everybody trying to highlight their occasion, when in fact, all we need to actually do is to collaborate. And I'm so glad that I'm able to work with Dr. SickleCell and with NGOs in Nigeria, Australia, outside Ghana, and even with the NGOs in Ghana, because again, together we can do more. It's together we can overcome sickle cell. It's not rocket science, it's actually fact. It's a very basic principle. So for me, there's a lot that needs to be done. And the fundamental thing is collaboration. But this collaboration, it has to be with set objectives. It has to be with common goals, because we can't keep forcing ourselves into collaborations that don't have any meaningful impact, or collaborating just for the sake of having collaborations because it's nice to be seen to be collaborating, or it's nice to be seen to have partners. So for me, I think that if nothing at all happens after Sickle Cell Awareness Month 2020, we should try to have meaningful collaborations that will last, collaborations that would actually affect the lives of persons living with sickle cell disease, whether it's in our countries or outside our countries or anywhere at all. And that when we go into these collaborations, let's focus on the ultimate impact, God's goal, which is the life of the person living with sickle cell disease. Everything else is secondary. So once we go in there and we see that we are focusing more on politics and people's feelings and what people want more than the person living with sickle cell disease, for me, that's a dysfunctional collaboration, and there's no point staying in that space. You need to move on and find other people who have the same goals as you, and then work together for the lives of the people living with sickle cell disease. So for me, that's basically what I think we need to do for Ghana and then across Africa.
Okay, Dr. Enam, I think you made a very good one there. But I would like to, pick points from what you said in terms of collaboration. You see, we are all in this, and we fully know that information is not easily accessible to, the people. And I want to give an instance now regarding that information now, and then connect it to how we all work together. Now, I will refer to two of the sessions we did last week with Pascasia. Okay. Yeah, she spoke from the perspective of the parent, and also Dr. Barrister Uchi. She also spoke on the perspective of the warrior. Now, you see, the smallest unit of the society is the family, okay? And if the family doesn't have good information concerning sickle cell, that's where the problem is. Now, taking the perspective of the parent, which was Pascasia, she said, as a parent, she had a child living with sickle cell, and she had no idea whatsoever what sickle cell was about. Okay, so she had to go on the internet and search for information on sickle cell that she could find to take care of her child. And as at the time, there was no information whatsoever in Tanzania at that time. So she said all she saw was information from West Africa, which includes Nigeria, Ghana. The informations were from patient groups, warrior groups, okay, were owned by warriors. So she was like, she couldn't get substantial information. It's just like you, Enam, now you're giving a car. I mentioned this in the radio program we had a few days ago. You're giving a car like Tesla. And right now, the only thing you know about normal car is that you can fuel the car uses wheel, that's the wheel drive and all. But a Tesla car is self-driving, which is electricity, which you don't know about. And even though you know about electricity, the use of electricity on that car, you don't even know where to go charge that car. And they tell you to move that car from point A to point B. That is how it is when you have a child living with sickle cell from the family perspective of the parent. They don't even know what to do, and there are little or no available information out there. Now, for the child living with sickle cell who was born into this world with a pre-existing condition and has no information or idea whatsoever, and the only person he or she could look up to is the first guardian he or she came to this world to see, which is the parent. And now the parent who doesn't have information regarding sickle cell, tell me what this child where this child will go to look for information on sickle cell. So this points back to what Barrister Uche, who spoke from the perspective of the warrior, said that her parent didn't tell her about her condition until months later, when, as a matter of fact, she heard about her condition from her schoolmates who were telling her that if I touch you now, you will fall down. If I do you this one now, you can die, and all those kind of these things. So if the parents were well informed on sickle cell, they would have taught the child from an early stage on how to respond to this stigma and everything that may come forth. So my question now is, I'm going to ask you the same question I was asked in the radio program at which I attended a few days ago. And the number one is, how informed do you think people are about sickle cell?
Thank you, Eddie. I think you've made a very, very good point, and your examples too are very practical. I think people are actually quite well informed about sickle cell disease. They know about it, they've heard about it. Everybody knows something about sickle cell disease because, as I said earlier, we all have a sickle cell story. So we all have a classmate who had sickle cell disease. We have a work colleague. We ourselves probably have a relative, a cousin or a nephew or something. So regarding knowing about sickle cell disease or hearing about it, I think a lot of people have heard about it. But then the information that we have is not, people don't act on it. It's not actionable information. And for me, I think that the problem with that is that people think of sickle cell disease as a future occurrence. They don't think of it as something that can happen to them. Even with prevention messages, it's about you preventing your child from getting it, not about you preventing yourself from getting it. And so it's about an unknown future, understand? So even though people hear about it, they can't really personalize it because it's something that may or may not happen. It's a probability that they have to work around. But then if, for example, I tell you today that if you have unprotected sex, you can get HIV. You are getting the HIV for yourself and it's affecting your own life. But then when I tell you that if you are AS and your partner is also AS, you have a 25% chance of probably having a child who has sickle cell disease with every pregnancy. It sounds so distant. So yes, you've heard the news, you've heard the information, but then translating it into an action is the challenge because, again, you don't feel like it's a you thing. It's about preventing someone else from having it. And maybe for those who have that personal experience, they can analyze themselves and translate it into action. But then when you don't really have the personal experience, then it's difficult to say if it's a 25% chance of having that child, it's also a 75% chance of not having that child. So then I'll take the risk. So for me, it's not so much about not hearing about it. They've all heard about it. Most people have heard about it, but it's about translating that information into actions. That's where the challenge is. And so that's where in our advocacy, we need to focus and make.
Can I cut you in a bit?
Yeah, sure.
Okay. You said everyone have heard about it, but it's not translatable into action, right?
Yes.
Good. Yeah. Now the thing there is that I am looking at it this way now. How exactly do you want it to be translated into action? When we keep repeating the same thing over and over again. As a matter of fact, we are used to singing this hymn. I call it a hymn right now. 300 people are born with sickle cell disease. When you have this thing, you have 25% of getting. It's the same thing. You understand? What now? When we keep hearing this thing over and over, how do you expect this thing to be translated into action? As a matter of fact, we have surpassed, because those statistics are old. And which brings me to my next question now. I'm going to ask you, where exactly are they getting their information from?
This is very true. I think that this is it's actually two questions in one. Where are the actually, I don't know. And that has been a major challenge for me because, for example, I mentioned newborn screening in person. So Ghana has been having a newborn screening program for years. We started this thing a while ago, and yet we keep quoting old data. We keep saying 2% of children born in Ghana have sickle cell disease. 15,000 children are born with sickle cell disease each year. But then at the new publication, this information was said like 10 or 15 years ago by one person. And then since then, we've not been able to have new publications. We've not been able to record, like have records of anything, like the new data on the babies they've been screening since that time. So is it really 15,000 babies born with sickle cell disease each year, or has it increased? Or maybe has it decreased because we are actually doing a good job with our advocacy? There's no way to it. The sickle cell disease program that we should have at the Ministry of Health level don't exist. It's basically individuals running sickle cell disease in the country with their own knowledge and with their own agenda and with their own objective. So then with that, if the person doesn't really want to publish or doesn't see the need to publish new information currently, then unfortunately, you will keep the old babies are born every year information, and then you will not be able to actually have new statistics. So for me, the problem is that we need to expand the conversation. Sickle cell disease doesn't belong to one person or one organization or the oldest person alive or the most active person. It's a national thing. It's for everybody because we all have different skill sets. Some of us will probably be better at the statistics and keeping the records, while some of us are in the doing the screening of the people, and the lab people will be doing the testing. So we have to just come together and recognize that we have different strengths and utilize the strengths of everyone, but then not just keep on leaving the conversation to specific NGOs or specific people because they have been around for the longest. Because then in the end, what is the source of the data? Where does that data come from? So for me, I totally agree with you. Also, I think that for the, sorry, you made 2 points. I wanted to address that one, but it escaped me. I'll probably get back to it later.
Yeah, we'll get back to that one later. So I still want to hit on this one now you're talking about, yeah? Now, this is the reason why we actually came up with this campaign, Together We Can, because it is obvious that most organizations prefer working individually for whatever reason that is. But compared to other non-communicable diseases, you see that there is a more structured approach. Okay, and now speaking of structured approach, we at Dr. SickleCell look at the people first approach. You understand? Because the people who are actually feeling this thing more are the people you should listen to, are the people you should be in their shoes to understand how you're going to streamline your policies and how to make all these things come true. The coming together thing now is if you compare, if you look at cancer, if you look at mental health, if you look at obesity, you see they have one language. You understand? And this is the reason why we actually keep complaining about the same thing over and over again, because we're all saying the same thing, but we're not coming together in one voice to say it as one. Let the world know that the sickle cell community, the global sickle cell community, or the African sickle cell community are saying that this is what it should be. We know there are so many challenges. What if we take one and push for one and achieve that one and move on to the next one? Okay, now we are pushing for a unified world sickle cell team, whereby everyone within the sickle cell community globally are going to have one team. And we are working, we're still discussing partnerships with the World Health Organization and some other relevant stakeholders globally. And that's why the Awareness Month, which is Together We Can, and we thank everyone who actually participated and contributed their voices. It was very well, effective. As before, when everybody say, "Oh, it's Sickle Cell Awareness Month. I am doing my own. My team is together. I go." Next person say, "Together I cannot come." So everybody just speaking differently. So in a position where we have World Sickle Cell Day globally, and we say the team is we can and we all, for example. And now that is what the sickle cell community globally is talking about. So you think at that point, this government parastatals and the rest of them wouldn't, give attention to us? So when you see that the voice is one, and then tomorrow we say, okay, fine, we want to attack newborn screening. This is what we want. And everybody's saying the same thing. You understand? So I think we would have more impact. But if you look very well, as regards everybody working individual, you find that most organizations are not impact oriented. They just want to do because I am doing. What is your numbers? How many people are you impacting? That's the most important thing that has to do with advocacy and has to do with coming together.
And there's no originality. You just find that they are doing the same thing others are doing over and over. Meanwhile, that's why I really liked what Pascasia is doing in Tanzania. I mean, she decided, okay, these people are always, their focus is patient group. It's all about patient, people involved. What about the parents who should be talked about? And that was really nice. Like nobody ever thought about that. So I don't know. I think we should all be original about some of these things if really we want to make an impact. It's not just seeing that somebody is doing, oh, these people are doing this thing. It's working. Okay, let me try it too. So I don't.
Absolutely, I agree with you completely. I think that we are forcing, we know that when we collaborate, we can achieve more together. But at the same time, we're forcing certain collaborations that really needn't be. We are talking about getting the government to do this and that. But then if you've been in existence for 10 years and there are no tangible records of anything you've done, why should the government take you seriously now because you've attached yourself to other NGOs? People have been in existence for 1 year and then they've done so much with the little funds they have in their, and now they are saying let everyone come together. And even with that, the objective of this coming together seems to be because we want to go and let government do this and that for us. But then again, what have we done for ourselves? You just mentioned in Tanzania, somebody is talking about the parents. Understand? For our support group, it's for parents, patients, caregivers, everyone. But then if we've been around for so many years and with our small funds, we are not able to do anything that when you have the audience of the government, you can achieve anything. What exactly are you going to tell them? And for me, I've seen this WHO document that's about like 10 years old. It was done in 2011 where they were talking about what they want to do for Africa regarding sickle cell. And when you look at it, they are talking about the fact that there are so many aspects to sickle cell disease. And even right now, amongst those of us here, if we start listing off the top of our heads, sickle cell, like problems in the sickle cell space that we want to address, I'm sure that every one of us will get something separate that someone else wouldn't have to repeat. There's advocacy, there's newborn screening, there's research, there's training of medical personnel. There are so many things that need to be done in the sickle cell space. And even though there seem to be a lot of NGOs, most of them are doing the same things. And then we've left so many of the other very important things unattended. Now that we say we want to collaborate, again, we are collaborating for one thing and leaving the other ones unattended. And for me, I think that we are actually doing more harm than good because we are 100 NGOs dealing with 10 things and 10 of us are doing one thing each. At least everything gets attention. But if you go and put all 100 of us together and say we should all focus on one thing, then who is going to do the advocacy? Who is reaching the parents? Who is reaching the patients? Because now we are all marching to government to tell them to do something huge. Meanwhile, the basic things haven't been addressed. So yes, we need to collaborate. We need to come together. But when we are coming together, we need to ensure that our goals are aligned and that we are as broad as possible. One goal is not more important than the other. We can't say we are doing newborn screening and so we go to Bill and Melinda Gates or Mass Foundation or whoever and collect billions of dollars from them or millions from them, only do newborn screening and then totally forget about training of medical personnel for these people, because you will diagnose them and you start hydroxyurea, but who is going to monitor them? You diagnose them and then now their parents know, but there's no advocacy to help them. There's no support group to help them. So every single one of those points is important. So for me, yes, let's collaborate, but then let's make sure that we are dealing with every single aspect of sickle cell disease and not just focusing on pulling in to do specific things. Because honestly, for the things that even people have been able to pull governments for, you realize that the government just gives them like an inch and then they do the rest. So if you have not, your house is not in order and then they sort out things for you, you will still fumble the ball because you still don't have things in order. So we also need to address those issues.
Okay, Dr. Enam, before I talk, I need to talk to the audience that you can still join in by dropping your message in the comment sections for her. She would answer it. And if you need to follow her, you follow her at Sickle_Life on Instagram as well as Twitter. Am I right, Dr. Enam?
Yes. And then
Okay,
SickleLife
now
on
speaking
Facebook.
of on Facebook, okay, speaking of what you were saying now, that there are a lot of things that we have, to address, and instead of everybody just doing the same thing. I actually understand from what I see within the sickle cell community is that everyone is passionate, but not everyone is creative. Okay, so that's why you see almost everybody doing the same thing. Oh, this person is doing clinic. Me too, I must do clinic. You understand? There are a lot of problems or challenges rather, that has to do with sickle cell, and you can actually list those challenges and create a response to those challenges. It doesn't have to be because of I want to do advocacy, I must do a work. If there's a work already being done, well, instead of doing your own separately, why not partner with the work to do, what they're actually doing? Then you look for another. There are other challenges. You look for responses to these challenges to face. But I just found out that a lot of people are very passionate, but they're not creative. So that's why we need more creative people to come into this community to help out. So you understand my point, yeah? Yes. So we could not to waste our time because we have another session by 3 and we have to prep on. So if you have any questions, please, we still have about, let's say, 10 minutes thereabouts to take in your questions for Dr. Enam. So now, Dr. Enam, one more question I'm going to ask you before we close the day. And that is, where can the right information about sickle cell be gotten? Now, before I would let you come in, because I know you will tell me if we check on Google, we are going to see information on sickle cell. Yes, no doubt. But if you understand how Google algorithm works, if you're perhaps looking for, maybe you Google fan, for example, or AC, and you Google it, perhaps you want to buy it, it's going to bring stores around Ghana to you who deals on fans and AC, right? They won't suggest stores in Nigeria or in Philippines to you, right? They will suggest around your locality. Now, when you Google about information on sickle cell, you don't see anything that comes around your locality or your immediate locality, if maybe your neighboring country, or where information you see that comes in, and maybe from the American Society of Hematology, from NHS, from NIH, and the rest of them. So what are we doing? That's another problem now, because if you look at in the US, almost the whole hospitals has one information or the other on their website to at least reach out to the people should they want to have information. So what are we doing in this part of the world as regarding that? So the question remains what I asked: where can the information be gotten locally? You can start from Ghana.
I think this is a very valid question. As my introduction, for me, when I was unwell and they said I couldn't do any physical activity, I resorted to blogging, and I actually realized that there was room for blogging about sickle cell disease, because it was like no one else was blogging about the condition. That was about 5 years ago. And so I was just sharing my experience, and then people would reach out to me from other countries about similar experience. Medical students who was blogging about having sickle cell disease. It also really attracted people to me. So I was getting really high numbers, and I'll check the views, and it's like Nigeria, South Africa, US, UK, Barbados, like it was everywhere. And so I realized that there was a very huge gap that needed to be filled. So for us at SickleLife, something that we did in the early days was that we had something we called My Sickle. And so what we did was that we created a platform, and then apart from that, we also just to submit an entry via Gmail. So just share your story. So if you go to SickleLife.org right now under blogs, you'll see my story. You'll see stories of other people sharing their experience of sickle cell. So for example, the lady in Tanzania should probably also create like a story, send it to us about being a mother of a child with sickle cell disease. So then when somebody in Ghana Googles it, and then they start going through the blog, maybe their interest is of the parent of a child with sickle cell disease. Someone else's interest is of how this person who has sickle cell disease, also a doctor, stuff like that. I mean, for me, it's a failing on my part, and it's been burdening me for a very long time because personally, as my schedule got crazier, I wasn't able to put in the time that it takes to write. And I also think I became more timid in my writing because once I graduated from medical school, I didn't have the leeway to put out anything because now I'm a doctor. So people will assume anything I'm saying is medical fact more than personal opinion. So then that kind of slowed me down. But then I still think that we have room to still admit people's stories and just share it. Let people share their raw emotion and then their experience living with sickle cell disease so that others will see. Other than that, we have these micro blogging things. So on Instagram and Facebook and Twitter, like we share tidbits on sickle cell disease. Of course, when you are somebody who is maybe new to the diagnosis, you want like an article, you want something that is relatable, but at the same time reliable. And so for that one, I think that we need more of our health workers to enter that space. I've tried to engage with some of my senior colleagues, and these are like consultants, hematologists, but for them, they are more skewed to research papers. So if you actually take the time to Google like scholarly articles on sickle cell disease, you'll probably see some of the names of like consultant hematologists. But then the challenge is that that is not what the average person wants. And it's very difficult to say that you are going to translate somebody's scholarly article into like layman terms, because then you are going to be infringing on certain copyright laws and things. So I think that yes, it's a challenge. That the information is there, but as you said, you probably get things that are not relatable to the context that you are in. So maybe I'll take it on and then reactivate our blogging session so that at least for the people on in Ghana and maybe Nigeria, you can benefit from it. But also I think because of the time constraints, one of the things that we are all shifting towards is these webinars, vlogging and stuff, because that one, you don't have to put in as much time in writing and editing and doing photos and stuff like that. So again, maybe we may not be able to have all the time to do the blog post, but then I think once a week, committing about an hour to just engaging with people about sickle cell disease and having the session recorded so that people can look up the session anytime, I think that that could help. So granted, there's a gap, but then I think that we'll advocate and we can also reach out to the medical community to also assist us.
Well, speaking of time constraints, if right now writing is actually really kind of, I understand, but if everyone is actually tilting towards doing videos and talking about this information, it's not bad as well. These videos can also be transcribed into writing, right?
True.
Okay, Dr. Enam, in as much as we don't want to discontinue this conversation, we have to go because we have to prep for the next session, which is very important.
There's a question.
Okay, there's a question. Okay, that's yours.
Something about data. Data and technology can be a challenge for most people. How can we reach people who do not enter subject? What we did was to actually give back data to participants. So in our in-person mentorship project, we would have actually spent a lot more money because we would have had to have a location, hire buses, provide food, pay entrance fee for the children's park and everything. But then since because of COVID, we weren't able to meet in person, it was online. So then we now drew a budget for data, and then we had the participants register, and then we send them back data to cover the time there, because I think it's important that when we do these things online, we don't exclude certain people. So yes, with those who have network, we can provide the data, because if we were doing it in person, we would have still had a budget for it. So, and I think sponsors would be willing to pay, like give sponsorship for something like this, because we don't want to exclude people. But then for those who are like in out of reach areas, unfortunately, there's really not much we can do about it. And I really don't have a solution to that, because they probably still wouldn't have been able to read the blog that we would have created. So, I mean, for what we can do and what we actually did in our last project was to send back data to those who participated in the project online.
All right. So if you still have any questions, we have 2 minutes more before we end this session. And don't forget, by 3 p.m., we're going to be having another session with some active stakeholders in Nigeria to discuss the Nigeria STD Bill 2020. Dr. Enam, it was really, really nice having you on this session. Trust me, I believe the audience, if you agree with me, that your talk was very much insightful and very resourceful as well.
Thank you, Dr. Bankers. And I really learned a lot. And I see you as someone who is very open-minded, very passionate about this cause. So thank you for honoring our invitation. Thank you, everyone who is or who has participated so far from the beginning till now. Thank you for being here today as well. And like I dropped in the comment box or in the chat box, you can follow the conversation. You can continue the conversation on Twitter. Just use the hashtag Together We Can, and we'll continue with it from there. You could ask your questions, you could throw in your comments, you could tell us how, what highlights you got from this session today, and just drop it on Twitter and pick it up from there. So I also like to use this opportunity to thank everyone who partnered, with us to bring this to fruition. So I would like to thank SickleLife Ghana, Dr. SickleCell, SickleCell Engagement Initiative, African Film Consortium, Cells of a Generation, Fresh Cell Inc., and WHO Afro. So thank you, everyone. Thank you, Dr. Bankers.
Thank you for having me. So for the Ghanaians, the next session is actually 3 p.m. No, 2 p.m. Ghana time, right?
2 p.m. Ghana.
Yeah, 2 p.m. Ghana time, yeah.
Thank you.